Hi there, it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Hi everyone, super excited to do tonight's talk, and hopefully you can all get a lot out of it, because I think if you can learn to utilize these tools really well, it's very, very worthwhile.
Okay, go for it, Belle.
All right, so we get started straight into it. So we'll start off with a few slides, and then we're going to go straight into, I guess, some more the practical parts where you can try and utilize your massage tool. So first of all, why do we actually use these massage tools? So the most common ones, we would probably ask people to use a called Spikey balls. So one of these guys, and a foam roller. Unfortunately, I don't have a foam roller handy, but most of you may have seen one. It's just one of those big rubber kind of cylinders. They come in different forms with spikes. Sometimes they're flat, but there's lots of different types and different ones on the market. But why do we use them? So primarily it's to release any tight muscles in the body. The tight muscles can consequently cause pain in muscles or joints. And normally that's why with patients I see, they might present to physiotherapy. You might do what we call fascial rolling with normally more a foam roller. And we're going to go through a bit more information on this. Or with a spiky ball or foam roller as well, you might do what's called trigger point release. Okay, so that can all sound a little bit confusing, but let's put it simply. So I'm going to ask Sarah, which one do you normally ask patients to use, or do you use on yourself most commonly?
I am firmly in camp spiky ball generally. For me, I just find it's more versatile. I like that it's small. And I guess for me and my body, if I'm talking personally, the areas that tend to get tight in me benefit more from the spiky ball. And then generally for my clients, I think as a starting point, I usually get people to go spiky ball first. And then depending on the area, so I think there's some areas in the body that benefit more from a foam roller, and some you're better off using this, but I usually go spiky ball first to answer your question.
Yeah. Similar, I'm quite similar to Sarah, but really there's no exact science. It's whatever's more comfortable for you. So if you're unsure, hopefully, you might have a friend that has one or both, and you can borrow and try. Otherwise, both of them you can normally get for quite cheap at Kmart or a sports store. So that both of them could be a very good investment for different parts of the body. And it really depends on what you want to work on. Tonight, as we go through the examples, some of them will be with a foam roller, some will be the spiky ball, and the choice that I normally make will be dependent on the body part and what normally works better for most people. All right. So what is fascia? So I talked a little bit about what we call fascial rolling, which is obviously, as I said, what we do with a foam roller. Some of you may be familiar with this term, as we've spoken about it in past talks before, I think. But pretty much it's a sheath that connects the whole body together. So that probably sounds a little bit unfamiliar to some of you. And when I was at uni, we learned that muscles connected, from A to B on the body. But over time, as I've become a more experienced practitioner, as I've learned more, done more reading, I've since learned that there's something called the fascia, which then covers these muscles and connects parts together. Okay, so the fascia, it can be to support muscles, tendons, ligaments, tissues, organs, nerves, joints, bone. It's around everything. The way I often explain it to patients is that if you think about cutting a piece of chicken, so your chicken breast, normally you can see the meat bit, but right before you get to the meat and you use your chef's knife, there's that millimeter of kind of white, like very thin, like white skin. Okay, so you've got your fatty skin, then there's this sheath of white kind of tissue paper kind of thickness, and then it's the actual meat bit. So the fascia is that like tissue paper bit, and that's around us as well. I'm just going to stop for a minute. Sarah, do you explain any differently to your patients?
I've never heard you say chicken. Wow. It's a bit different, but good visual. What do I like to say? Yeah, I think it's like a spider's web. I think visually I found that analogy can be helpful. So spider's web, because it's not a hard structure. It's very light. It yeah, your muscles sort of fit through it. It connects to all different parts of your body, but it's really important to help us stay active and healthy. So it's an essential part of our musculoskeletal system. And often can kind of get missed because we talk a lot about muscles and we talk a lot about bone and joints, but fascia is everywhere. And that can still impact your movement. It can impact pain. So it's important that we try and, do what we can to keep our fascia healthy. But yeah, I think of it like a big spider's web. But I'll keep the chicken in mind for the future.
Okay, so if we're thinking about fascia, there's a few different layers as well to that. So the very top layer just under the skin is called the superficial fascia. And then we go into the deeper fascia, which is closer to the muscle. And around certain parts of the body, mostly organs, there's what's called visceral fascia as well. So if we refer to this diagram, this picture, oh, can we go back?
Yep. Sorry.
Just the picture in the slide. That's actually one piece of fascia that's been cut out of a body from a very clever anatomist. So this one piece of fascia, it starts at the outside of the hip and then goes down the outside of the knee, down through the shin, under the foot, and then up through the inside of the leg all the way to the groin. So that's all connected in one piece. So that's this person's, one part of this person's fascia. Okay. And just to make things a little bit more clear, so I talked about the different layers of fascia. So this is just another diagram just to explain it. On the left-hand side of the screen is actually a picture of an ultrasound. So if someone does an ultrasound where they've got that gel and the head on top of your skin, this is what the sonographer would actually see. So the top layer is the skin, obviously. Maybe there's a slight bit of like fat or adipose tissue. Then there's the superficial fascia, as we spoke about, the very first layer. And then there's the deep fascia, and then we go into the muscle. Okay, so definitely when we're using spiky boards, foam rollers, we're going to have the most impact on the fascia because that's actually before the muscle. You might influence the muscle as well, but definitely you're going to get to the fascia. Okay, in the first slide, I referred a bit to trigger points. Some of you may have heard of this term before, but what trigger points is in kind of layman's terms, it's very, very, very irritable spots in muscles. Okay. The most common one that most people will be aware of is that one in the neck. So often you might touch on this sore, stiff area. A lot of us get it from, using our phones or laptops too much. And you can just feel that, what some people call the knot in your neck. Okay. So this knot, obviously it's in my neck at the moment, but these can be in any part of the body. So it could be in my forearm, it could be in my hip area, in my glutes, in my calf. It really depends probably on each person's body and what they've done in the day or in the weeks. So everyone will have different trigger points in their body. So although we'll go through how to massage certain areas, how one person uses a board is going to be very different to how another person might use it and find their trigger points as well. So just quickly, what causes these trigger points? So as I said, muscle overuse. So if I go for a long run, perhaps I'm probably using a lot of my leg muscles. I often will be able to find some trigger points in my calf, for example. Poor posture, that can give me that trigger point in the neck. I might get some tight spots or trigger points across my chest, for example. If I'm standing in a position that isn't very good for a long period of time, I might get certain hip muscles that get very tight and then create a trigger point. For some people, stress can create trigger points, commonly again in the neck, maybe the back as well. And obviously repetitive motion. So running is one example. If I go out and play a lot of tennis, for example, my shoulder muscles might get very tight and I might get trigger points in my shoulder as well. The tricky thing, oh, sorry, Sarah.
I was just going to say with trigger points though, we're all going to get them. So I think if you're already thinking like, oh, how can I avoid getting trigger points? You can't. The way I think of it is because if I move a lot, there's a potential that I'm going to develop a trigger point. But if I'm really sick and I have to be really sedentary for a period of time, that can create trigger points and sort of, gunky fascia as well. So on their own, they're not a bad thing. But obviously that's part of what we think can cause some pain. So if you're starting to get symptoms or you're starting to find it hard to do the things you want to do, that's where we might want to treat these trigger points and make sure that they're not causing you too much issue. But don't worry too much about them. It's not a bad thing. They're not a disease as such. It's a normal part of muscles and trying to stay active and keep yourself healthy. But go on, Belle.
So we can go to the next slide. So the tricky thing about trigger points and I guess pain in general, and this is something I often have to think about when I'm seeing my patients, is that the trigger point might be in your neck, and that can cause pain down my arm, for example. Okay, so different trigger points in your body can cause pain in other areas. And why this is so, we think it's because of fascia. Okay, so the fascia connects your body, but then it can also create, I guess, pain in different parts of that fascia, what we call the fascial chain. So here are a few like common examples that I see in my patients day to day. So on the left, we have a picture of someone's glute. So on the crosses in the diagram is where someone might have trigger points. And those red patches are where someone might get pain associated to that trigger point. So if I massage or if I use the spiky ball on myself and go around that glute area or that lateral outside hip area, someone could potentially get pain in the middle of their buttock region. They could get pain at the back of their leg through the hamstring or down through the calf. Okay. Everyone is different though. So this is just one trigger point and one area. Doesn't mean I can find it on myself or I might not be able to find it on Sarah. This is just one example. Everyone's just very different in terms of what hurts and what might give them referred symptoms. And again, the referred symptoms aren't necessarily an issue. It's just a reflection of your body in a tight spot. So it's nothing to be scared about if you put the ball on your glute and you get some funny pain down your calf. It probably just more or less indicates a tight muscle. Okay. One more example that, again, a really common one I would see with my patients with neck pain. So this cross is on the front of the neck, so the area just above the collarbone. And sometimes when I find that trigger point on my patients, they can get pain down the side of the arm, the back of the arm, even down to the thumb and the second finger. So this one can also be quite a widespread one. Okay, so sometimes if you're doing your spiky ball foam rolling, you might get some of these symptoms in the body. Before I continue and start on the practical, I just thought of two more things that I should go through. And this is the reason Sarah and I spend a lot of time in our consults doing spiky balling or teaching foam rolling, is that it's often a very good adjunct to what might be happening in your treatment session. So if you're coming for physio, you might have some manual therapy to reduce pain, perhaps as part of your treatment. But that is often 10, 15 minutes perhaps. But your week is many, many more hours. Okay. If you're coming once a week and you got 10, 15 minutes of manual therapy, often that might not be enough. And unless you want to see your physio much more frequently, the other answer is to do more yourself. Okay. So it can save you lots of money and treatment time as well, if you can learn to utilize these tools. And also these are great for traveling. So often when you travel, you do lots of different activities. You might lift luggage, you might do more walking than normal. So it's good to have these and learn how to use them well, because they can, serve you well instead of having to find a physio whilst you're overseas as well. Okay, let's get into it. So as Sarah said, feel free to get up off your laptop. You can get to a wall and try and follow some of these videos. So I'll try and talk through them as best as I can. And as Sarah said, please ask questions as you go and we'll try our best to address them. Okay, so we're going to go from head to toe quite systematically. We're going to start with the upper traps or the neck area. So this is a very, very common area where a lot of our patients would get tension. So it actually runs from the base of the skull all the way down to the middle of the back. The area that is most commonly targeted with a ball is going to be that area in the shoulder that you might feel that knot. Okay, this is, do you want to just keep looping it, Sarah? So this is a very easy way to do it. All you do is put your back against the wall. You can't quite see my legs, but typically I would suggest you put your legs maybe a little bit further away from the wall so you can lean back a bit and get a bit of pressure against the wall. How much pressure you put on is totally up to you. Okay, so it's how much you can tolerate. You don't want it to be too uncomfortable. You probably want to be able to maintain that pressure for a couple of minutes, let's say. But the more you try and play around with things, the more you'll get a feel of what might work for your body, what feels comfortable. And I guess if you are starting out on a new area or you've never used a ball before, don't expect it might work perfectly on the first go. It might take a few different goes of feeling around, finding the position. You can see even on me, it slipped out. But it might take a while or a few tries to find your spots to kind of feel comfortable doing it. Okay, but once you kind of nail your position, your pressure, it's normally the muscle memory is kind of there, and it's normally quite easy for your brain to kind of find the spots again.
How do you, like, I get asked a lot, Belle, like, and someone's already asked, can you cause damage? Like, how hard should you push? Do people need to be worried about hurting themselves by doing this kind of strategy?
Of course, there's always a risk with any modality, but I've never had anyone hurt themselves more than maybe a small bruise. Okay, it'd be very difficult. These are pretty safe things to use. It'd be very difficult to hurt yourself unless maybe you had some sort of other health condition that might make you more sensitive to massage. I think. Sarah, have you had any patients that have ever hurt themselves using a ball?
Like not in a severe way, but I had someone for the first time last week, and I thought, and she gave me permission to share her story tonight. So one of the main strategies, we talked about. So she had some neck pain, and so got out the ball. She'd never used one before, so I was like, right, you're going to try this between now and the next appointment. But she said because she'd never done it before and she gave it a try, she did notice she was a bit sore for the day or two after. But thankfully she tried it again and was able to then sort of get into that rhythm a little bit. So I think it is normal if you've never done this before or you're experimenting on a new area. If you're a little bit sore after, don't be alarmed. Again, like any kind of treatment, that can be like a normal response when you get into a good spot, but just build up gradually. And I think with these tools, often I recommend just start with a couple of minutes at a time. You don't need to be doing this for an hour. Just try for a couple of minutes, and that way you can kind of see how your body responds before you, push harder or really go for it. But I think once you get the position, once you get used to sort of, shifting your body weight and getting into it, I think this can be a very good area to just be able to keep, managing ongoing, because the neck is definitely an area that can build up tension very easily, even if you don't have a lot of neck pain.
Graham asked, are there different sizes of ball and soft or hard? Yes, there's so many different variations of massage tools out there. It is a little bit trial and error, unfortunately. And, Sarah and I use these personally, but there's probably some people who might be different size to us. They might have different just personal preference. You can't really go wrong. Like say I had a smaller ball or a bigger ball, I'd probably struggle with because certain parts of the body, it's harder. But a smaller ball, it would probably still be okay. I just have to move my body more to get the ball around, I think. But unfortunately, it's a little bit of trial and error.
And I prefer, in terms of the soft versus hard, you definitely want firm. I think like if you can sit on it and squish it, it's not firm enough. And you'll see like we've got strategies in standing up, but also some of them, if you can get down on the floor, you can also, when we get down to the legs, you'll see there's some seated ones. So if the ball's really soft and you're trying to get into quite a big muscle group, you won't be able to apply enough pressure for it to really do any good. So I think go for firm. And whatever kind of size feels good, but I think sort of smallish so that you can get it into all the different nooks and crannies.
And then also with spikes, you can use a smooth ball. I've had plenty of patients ask me and they find it okay. I guess the spikes can tend to grip more to your body and also like your other surface, so the wall or the floor a bit better. So it tends to not slip as much. That would be the main thing as well. So just a bit easier to maneuver. All right, let's keep going. So my favorite way to do my neck area, so this is the same muscle group, the trap area again, is actually this, it's called the bull position, I think, but it's pretty much leaning into a wall. I like doing it on a door frame so that I can then put my head through the door. But you can see I'm using my legs to put a bit of forward pressure onto my neck area into the wall. The main thing I see patients do incorrectly when I teach this is they're not quite horizontal enough. So you want to be looking straight down at the floor, and you want your upper body to be close to parallel with the floor.
Where? In pushing into the wall.
Yeah, so you can see, and again, you can control the pressure. That is always the key, that you learn to, I guess, know how much pressure your body can tolerate. And this one, I tend to get really good relief. Personally, I think most of my patients like it as well if they find getting into that position not too uncomfortable.
Beautiful. Any more questions, Belle? Do you want to see if there's any other questions along the way, just while we're on the neck?
No one. I think we're good.
Okay. Yeah. So this one, yeah, I find I don't like this one as much as Belle. I just find
really? I didn't even know that.
I don't know. I just find it's just a bit too much effort.
It is harder, but I get a much better force. I mean, you guys, if you are trying as we go, as I'd love you to, you can put in the chat what you prefer as well.
Yes. Yeah.
Again, there's no right or wrong. Let's just give it a go and see what floats your boat a bit. Yep. All right, let's move on. So that's probably the main area that's the easiest to do in the neck, and that most people can manage reasonably well. All right, so the shoulder. This is a little bit trickier. Okay. So the area you're aiming for is what we call the rotator cuff muscles, or your posterior cuff. It's pretty much the muscles all around the scapula area. So you'll see I've kind of deliberately rounded my shoulder, and it's if you feel around your shoulder blade, you should feel that bony area that sticks up at the back of your shoulder. You want to be just below that. Okay, so you kind of need to be side onto the wall, and again, you'll see my legs are a bit further out than my body, so that I can lean into the wall a little bit as I'm doing this one.
And why do you find, or who's the sort of person that might really benefit from doing this particular area? Is it people with shoulder pain or neck pain?
Mostly shoulder pain. A lot of people will be surprised to find sore spots in the area because it does feel a little bit bony. But definitely shoulder pain is one to go. I do this on myself a lot if I've done a bit too much sport or gym exercises or tennis, and I'm a bit kind of sore in the shoulder. It's a really good one to do.
There's some good tips in the chat. Someone said placing the ball in a long sock can make it easier to get into position. That's genius. I've never thought of that.
That's very good. I love that.
That's really helpful. And someone's asked, Bill, I know we want to touch on this a bit. Can you do too much of these things? Or what would be some things to look out for?
I would start with a couple of minutes once or twice a day. Okay. If you happen to love it, you can do more, but I'll do that for probably a couple of days to a week. Again, it's not an exact science. Okay. Most people don't last more than a couple of minutes because you either get bored or it's too sore. But it'd be hard to do too much. You'd have to really go more than like half an hour, I'd say, and really go for it. Because I guess we're also limited. The pressure is going to be limited to your body weight. Actually, I've got a good story about this shoulder one whilst you guys practice. So I've mentioned tennis a few times, and he's a bit younger than me, but young tennis coach had some shoulder pain, and he was telling me some of his symptoms, and I knew a bit of his history given he's a tennis coach, he's played a lot of tennis. So I gave him a spiky ball, and I told him to do this every night, and he was waking at night about 3 or 4 times a night with shoulder pain, and he couldn't first serve, he couldn't do his first serve. Anyway, I taught him this, and it actually fixed him within a week. I was surprised. So I do not promise those results, but on the odd occasion, if you choose the right way to do things and you stay consistent with it, it can definitely help with a lot with symptoms, I'd say.
And any opinions, Belle? Someone's asked about massage sticks or massage canes.
Yep.
They provide sufficient pressure. How would you throw them into the mix?
They can also work really well, and it depends on your body part and how well you can also maneuver your body. I've seen, I guess in my time as a physio, people have asked me all sorts of weird and wacky questions. I've seen all sorts of massage devices. Some work really well if you know how to use them. It can work as well as seeing someone for manual therapy. I guess we're sticking with these tonight because they're most easily accessible. in most sports stores, Kmart, physio clinics sell them, and foam rollers, people have them as well. But all of them can work really well, and it's just whatever's easiest for you to use and find your spots.
Yep, agree. Okay, can we move on?
Yep.
Okay,
so that's the shoulder. Rhomboid, so this is the area just below your neck, kind of between your shoulder blade and your spine. Again, with people that sit a lot, we do a lot of shoulder exercises, shoulder pain, these can get very tight. But this one's pretty simple. Bend your knees a little bit, lean back against the wall, similar to what we did for the first neck one, and then you want to roll up and down. So it can get a little bit tiring on your legs. Some people I have heard will just lie on the ball and just find a sore spot and just kind of lie on it and kind of shrug their shoulders around and move around their shoulder blade area a little bit. This is probably a little bit easier to maneuver if your legs are able to do that.
Cool. Belle, someone's asked the question, because we're still around the shoulder. Someone's tried doing the shoulder ones at times. However, sometimes it can make the pain worse and can even sometimes trigger a headache. So if a client said that to you, what would you advise?
I probably wouldn't keep going if it's making your pain worse. Never you want to keep doing something if it's making your pain worse, unless someone has told you explicitly it should make your pain worse and there's a reason why it should make your pain worse. But I mean, you could, if you think it's the right thing to do or someone has suggested you should work on that area, maybe go a bit gentler. If you're getting a headache, that's not unusual, because again, thinking about the fascia and trigger points and how that works, maybe it is triggering a headache. But I would if you want to persist, and it's without obviously meeting you and seeing how you respond to things, it's hard to give you specific advice. But my general advice would be, you can still keep going, but maybe ease off your pressure a bit.
I'll go for a bit less time and experiment a little bit. But that wouldn't be a response that we'd want you to continue to get, because that's, a sign that we're not on the right track. Someone's asked, can they do it in bed, Belle? Would you use these sorts of tools in bed?
Typically not, because in bed, it'll just sink into the bed. So you won't feel any pressure. You won't feel the pressure of the ball, because the ball will sink into the bed too much. You need ideally a much more firm surface, such as a wall, the floor, etc.
Oh, good. All right, we'll move on. I think we're still upper body, but we will continue.
So chest, another favorite of mine. Anyone with shoulder pain can benefit with this. Anyone that is working on their posture from too much sitting. The area that we're working on is the pec muscle, which goes from kind of the sternum out through to the shoulder. So it's, it might be about 2 inches or so kind of space across here. I like doing it in an open space like this or a door frame, so I can my head doesn't touch the wall. Some people do it in a wall, but I think this is better. But my head can kind of go past the wall, and I can then push in with my body a bit more to get a nice pressure. This one is pretty easy to do as well, I think, and can be very effective if done at the right time.
Because even with posture, again, I think, and we're still trying to be aware of this too. Remember, there's no sort of good versus bad posture. We're all going to develop sort of tight spots just from doing our lives, and at this stage, whether it's seating or being on your phone or using a computer or even sort of doing physical work and exercise, this again is a really key area that can get tight and then start to cause some pain. So again, even if you don't necessarily know if you're tight or you're not getting pain there, it can still be useful to try just to make sure that your range of motion, you can move as well as possible. Cool, but hopefully I can see a couple of you trying that, which is good. So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. But otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.